Hi, I'm Fiona Smith and I'm one of the vets at Chestnut Vets, a small animal practice in Hertfordshire where I deal mainly with dogs and cats. I absolutely love animals. I just think they're amazing and I'm completely fascinated by science. So for me, being a vet is probably the best job in the entire world. I spend my days advising people on how best to keep their pets healthy and safe. And if they unfortunately do become unwell, I try to work out what's wrong and do my best to try and fix them. My particular area of expertise is small animal medicine. It's a little bit like paediatrics. Our patients can't tell us what's wrong, so like a detective, I have to try and piece the puzzle together. And I do this by combining blood samples, x-rays, ultrasound examinations and endoscopy, where we might put cameras into various orifices to look out to what's going on the inside. It's an amazing privilege to be able to fix a patient and then see it go home and see the response of its owners and how happy they are. Within this, my absolute love is cardiology and the working of the heart. Often these patients are really poorly, and the question that people want to ask me is, can you fix my pet? And how long do you think that they will live? And to do this, we need to do tests in a very specific way to try and keep the patient safe, because often they're not well enough to be sedated or anaesthetised. I often use a combination of ECGs, looking at the electrical activity going through the heart, and also ultrasound, doing an echocardiogram to look at how the heart is working. And it absolutely blows me away that you can just use an ultrasound probe just onto the side of the patient's chest, and it can transmit an image to a laptop showing the structure of the heart, how it's actually beating, what the valves on the inside are doing, and charting the direction of blood, whether it be in the right direction or even the wrong direction. I have an ultrasound examination here to show you, which shows the inside of a heart, and it shows a heart valve which, when the heart beats, should snap shut and make a nice tight seal so blood moves in the right direction. In this poor dog, the valve was leaking, and we can see here blood moving in the wrong direction. And this video shows the blood leaking backwards, which eventually dams back into the lungs and under high pressure causes fluid to leak and that makes the animal struggle to breathe. We can even use ultrasound to look at the speed of this blood flow and help us choose what medication might be most appropriate to help the patient live as long as we possibly can with a good quality of life. So you can see, by using all of these techniques, we're able to help our patients hopefully live a longer and happier life. It's a real privilege to be involved in this profession.